Welcome everyone. Today we are exploring the behavioral assessment of vocational skills, commonly known as the BAVS. As future occupational therapists, you will frequently work with brain-injured adults seeking to return to the workforce. This clinical schematic will introduce you to a tool designed specifically to measure their real-world functional ability and vocational readiness. Let's look at why the BAVS is necessary. Traditional neuropsychological tests are typically conducted in quiet, highly controlled environments and focus on isolated cognitive constructs like memory or cognitive processing speed. The problem? They often have a massive blind spot, grossly overestimating or underestimating a client's actual ability to function in daily life. The BAVS addresses this by placing the client in a simulated work environment with a supervisor role play. This allows us to observe functional application, directly integrating cognitive variables to accurately predict vocational readiness. The core purpose of the BAVS is to provide reliable data on this vocational potential. The anchor task we use is assembling a homeowner's wheelbarrow. But here is the critical paradigm shift you must understand. This assessment is not heavily weighted toward motor abilities. You are evaluating how the subject approaches the task and relates to you, the supervisor, not just how much of the wheelbarrow they manage to put together. To set up, you'll need the unassembled wheelbarrow, instructions, and ideally video recording equipment. Altogether, you'll schedule 90 minutes for the session. You'll need about 15 minutes to set up the work simulation. 45 minutes will be devoted to the administration with the client. You'll use the final 30 minutes for scoring, interpreting the results, and charting. You will instruct your client to treat this 45-minute work simulation as a real paying job while you adopt the role of their supervisor. The ground rules are simple. No tools are allowed. Nuts and bolts must be hand-tightened. Importantly, if you have a patient with severe motor impairment or paresis, provide physical assistance as needed. Safety is our top priority. Remember, we are scoring their behavioral and cognitive process, not their physical execution. Now let's walk through the 45-minute timeline and your active interventions. At minute 0, you begin with an unstructured approach. Instruct the client to think out loud as they work, providing very little direction so you can see how they establish their own structure. At the 15-minute mark, you will purposefully introduce a distraction. Direct the client completely away from the wheelbarrow to do something else, like straightening a shelf or retrieving objects from a closet for 3 to 5 minutes. This tests their distractibility, cognitive flexibility, and ability to resume a task. At the 30-minute mark, you inject specific, confrontational criticism based on an error they've made. If they haven't made an error, find something minor to criticize. Act like an unreasonable and overly critical boss. Your style must be direct, but never hostile. If they ignore you, repeat it. This is crucial for assessing their emotional regulation and reaction to authority. Finally, at 45 minutes, you end the session. Immediately upon stopping the task, you will ask the client 4 specific questions. How do you think you did? How much longer would you need to finish? What did you find the most difficult? If you had to do this over again, what would you do differently? Encourage the client to be specific in their responses. Ask them to explain what they mean. You need to collect qualitative information that will allow you to rate their ability on the O-Net cognitive ability variable for oral expression. Record their answers carefully so that you can interpret the results and generate a short report. Use their answers to make qualitative notes on the client's self-awareness, planning, judgment, problem solving, and oral expression before you calculate their formal scores. Speaking of scoring, you will evaluate the client across 16 variables broken into 3 categories: cognitive and executive, emotional and relational, and execution. You'll rate dimensions like organization, attention to detail, emotional control, and persistence. Each variable is scored on a 1 to 5 behaviorally anchored rating scale. For instance, a score of 1 in attention to detail means they worked with care and accuracy, while a score of 5 means they avoided or minimized the importance of detail even with encouragement. A score of 1 in emotional control shows they can tolerate frustration, whereas a rating of 5 indicates they became aggressive and required you to terminate the task. This is one of those opportunities that you'll need to use to screen clients for poor emotional control, which is absolutely the worst behavioral problem a client can have as they try to get back to work. You need to try to pick it up at the clinic so you can help them manage their frustration safely and constructively. Once you tally the scores, you will use the impairment severity matrix. Scores between 16 and 31 indicate above average to average performance, while scores climbing from 32 up to 80 show increasingly severe levels of impairment. But please, heed this clinical caution. The BAVS is a brief screening device. It should complement your other assessments, and you must never use a BAVS score as the sole basis for important treatment decisions, such as excluding a client from a training program or rating them as non-feasible for competitive employment. You'll need to have other work simulations in the clinic to cross-reference the client's performance on the BAVS. If you find consistency with problems that cropped up with more than one work sample or situational assessment, you'll use that to guide your treatment recommendations and rehab planning. If a client does poorly on only one work simulation, they may have just had a bad day. That doesn't mean the test is invalid. It simply means that you need to look more closely at what caused their poor performance. Remember, there's a lot on the line here for the client and their family. Being unable to return to their career can create major problems as they get older, such as putting them in a terrible financial situation during retirement. Although they may qualify for some sort of disability income benefit now, the loss of their career is likely to impoverish them in the future. Always view your client's performance through a dual lens, the physical product versus the behavioral process. You're going to have clients who could successfully assemble only a moderate portion of the physical wheelbarrow, yet still receive an acceptable, high-functioning BAVS score because they effectively managed distractions, reacted well to your criticism, and tolerated frustration. Our clinical experience has demonstrated a significant gender bias in the United States and Canada. Men more easily accomplish the assembly and do it much more quickly than women. Because the BAVS has a gender bias based on its difficulty level, we designed the doll chair assessment tasks at the Washington University St. Louis School of Medicine's Occupational Performance Clinic. In our own clinical practice, we use both instruments, gradually challenging our clients with increasing difficulty levels on a just right challenge basis. We like to start with the baby bear chair and advance our clients to the mama bear chair and the papa bear chair before administering the wheelbarrow assembly. Why do we focus so heavily on process over product? Because it helps us better understand the client's executive function abilities and their functional cognition. When we look at predictive validity, traditional intelligence tests such as the Wechsler Adult Intelligence Scales don't correlate well with actual work capacity, especially in jobs with high cognitive demand. The BAVS is an excellent top-down instrument to measure functional cognition. BAVS results strongly correlate with both work quality and work quantity. BAVS offers predictive power that traditional clinical tests lack, helping bridge the gap between your clinical measurements and your client's real-world vocational success. It's also very engaging and has a high level of challenge that's hard to replicate in the occupational therapy clinic. The BAVS was designed by occupational therapists and neuropsychologists working with neurologists at the Traumatic Brain Injury Treatment Program at Daniel Freeman Hospital in Inglewood, California. Clients who were aerospace engineers, corporate executives, and healthcare professionals just weren't being adequately challenged by traditional occupational therapy tests that were measuring instrumental activities of daily living. They also did well on the formal neuropsychological testing. But problems arose when these clients tried to return to work. They just couldn't keep up with the pace of work, the distractions at their work sites, and the complexity of their old jobs. The BAVS helped the treatment team uncover some of the problems these people were likely to face at work, so they could be addressed in the clinic. This substantially improved the clinic's success with these clients trying to return to cognitively demanding occupations. If you want to expand the range of clients you can assist, which is always a good marketing strategy, you'll find the BAVS to be a very useful instrument. These clients are more demanding and require much more expertise from their treatment teams. However, because they almost always have long-term disability wage replacement, they tend to persist in neurorehabilitation and have a higher rate of success in returning to their careers. Together with the DCAT, the BAVS provides several levels of progressive occupational demand so that you can continue to offer your clients a just right challenge as they progress through rehab. The client you see on the screen now was able to get back to work using these tools in the clinic on a 3-day-a-week basis over a 10-month-long rehab program more than 15 years ago. In his case, the primary treatment team was an occupational therapist and a rehabilitation counselor. The funding for his extensive program was arranged by his attorney. He and his attorney were anxious to help him get back to work as soon as possible so that he could take care of his family. This was endorsed by everyone involved and turned out to be a wonderful outcome. Over the years, I have helped several thousand clients get back to work and/or resolve their disability claims. Often, this involved looping in their attorney to help with funding. As you will see when you enter practice, there are many funding resources, but the one most practicing therapists fall back on is health insurance. You may have personal experience with how difficult it is to receive adequate treatment for healthcare problems that are complex, for instance, a mild traumatic brain injury. Unfortunately, the healthcare insurance system is unlikely to be your best funding source, especially for clients seeking to return to highly cognitively demanding careers. The trajectory of work-oriented neurorehabilitation is much longer and more gradual than work rehabilitation after a musculoskeletal injury or heart attack. Helping people with traumatic brain injuries or strokes takes much more time and is much more expensive. I've worked with clients in all of these arenas and achieved notable success, but everything really depends on having adequate financial support for a prolonged experience in neurorehab. As you graduate from your OT program and enter practice, please feel free to reach out to discuss this further with me. I'd like to be able to help. Thank you for your attention to this introduction to the behavioral assessment of vocational skills. You can purchase the BAVS assessment kit with all the necessary components through mathesondevelopment.com. The DCAT is also available from Matheson Development. Although each assessment can provide an excellent experience for your clients, the results from both assessments complement each other. I'm Dr. Leonard Matheson, and I really appreciate your interest. This is important work for all of us.